limitations? What shouldn't you be doing with Google Glass?
Well, I think that Google Glass it's another electronic device that allows us to connect and communicate. So just like we learned to do with smartphones or with cell phones, when they started having cameras, you have to use your moral judgment, your personal ethics to limit what you do. I mean, you shouldn't be recording without permission. You shouldn't be streaming without permission. You shouldn't be doing anything that you wouldn't do in real life. I think it's sort of it follows the basic rules that any other device should follow. At the beginning of the Google Glass hype, people really started getting really nervous about people being recorded or people recording with Google Glass. But the same thing happened with smartphones. If anyone had the smartphone inside a bathroom, and then the people get alarmed that someone was filming something or taking a picture. If you're in a movie and you're recording the movie with a smartphone, you shouldn't do that, and you shouldn't do that with Google Glass. So I don't think it adds any different set of responsibilities. It's the same responsibilities that you should have with any electronic device that allows you to establish connectivity and communication in a remote fashion and record in a remote fashion. So
we're starting to see some vendors come out and working specifically with Google Glass. What are some of the more unique uses for Google Glass that you're seeing some of these vendors come up with? I know we talked a little bit about augmetics and some of the stuff going on at Stanford, Beth Israel here in Boston. There's a couple vendors down in Texas, I believe, and then also we mentioned Singapore and other locations around the world where Google Glass is. Yeah. You're starting to see it come up in the provider setting, and there's some really interesting new ideas for how to use Google Glass. What are some of the more intriguing ones that you see right now?
Well, as you said, there's a few or maybe several vendors out there, young companies, usually startups that are almost not startup anymore. But Augmetics, for example, their idea was brilliant, and I had the pleasure to meet them, Ian Shaquille and Pelu Tran, almost a year and a half ago, and they told me a little bit about their idea, and I thought it was brilliant, and now they're making it happen. They're using Google Glass, at least one of the uses is to basically stream the interaction between a patient and a provider, stream that interaction through Google Glass to a remotely located scribe, so that when the provider finishes the interview or the interaction with the patient, the provider, says goodbye to the patient, goes to the computer, to the electronic medical record, and all the information that is pertinent from that streaming of audio and video data is already in the computer. And it is edited, and all you have to do is review and sign. That's my understanding of what they're doing. I've seen a little bit of a showing of that, and I think it's brilliant because it potentially can save a lot of time. It potentially can decrease the potential error from not remembering what the patient said or what you ordered, so it really helps you again improve that interaction by streaming the information through a device like this. People out there like Droiders, like Pristine, like a Third Eye, like connected context surgery. They are creating HIPAA secure applications to stream video or stream data, and that is obviously very important. Google Glass, at least in the healthcare setting, will never work unless we can assure that you meet the federal standards to keep patients' privacy, patients' information private, HIPAA compliant, and now that is almost a thing of the past. When Glass started, one of the big things in the healthcare was that it wasn't HIPAA compliant, and people got really nervous because you could do a hangout and connect to people by audio and video, but that wasn't up to the standards of the federal government because you go through Google. So in theory, Google would have access to that interaction, but and that's that got a lot of negative press. But very soon after that, then companies started appearing. The industry started producing the apps that we needed to do the same connectivity, but in a HIPAA-compliant fashion. See, when I even thought about using mobile devices like iPod Touch and then smartphones to do teleconsultations for trauma, that was the first time that was ever done. We did it at East Maine Medical Center. I had a TED Talk, TEDx Talk in 2011, and I thought of using FaceTime initially when I heard about the iPhone 4. Wow, that would be great to connect. Just like I connect with my folks in Venezuela by video, why can't I connect to the doctor in St. John's or Madawaska or Calais from my smartphone, rather than a big system, computer, screen that needs it costs a lot of money and needs a lot of money to maintain. So FaceTime obviously was not the right choice intuitively, because it's open and it's not HIPAA compliant. Then we tried doing Skype in an encrypted fashion, and that wasn't designed for that, so that didn't work too well. Within months, the industry produced 3, 4, 5 apps that you download for free, and then you pay maybe a fee and connect. Same way you connect with Skype or FaceTime, but in a HIPAA-compliant fashion, which is what we're using now. I have an app in my smartphone that I can connect to a doctor in Calais or in Penobscot Bay Hospital or Penn Bay Hospital or Penobscot Valley Hospital, any of the 17 hospitals in our telehealth network from my smartphone, and in a HIPAA-compliant fashion. So that I think the industry will provide what we need if we ask the right questions.